Hi, my name is Myron, and this is my presentation on ketamine. The introduction and drug class, the history, it was first introduced in 1962 as a replacement anesthetic for PCP. It was first synthesized in Detroit, Michigan, and its first uses were for emergency surgery during Vietnam War as an anesthetic. And for the drug class, it's a psychedelic slash hallucinogen, and it's specifically classified as a dissociative anesthetic. And then here is the molecule structure for it right here, along with some other drugs as well. And then for the mechanisms of action, so it kind of has two mechanisms of action, one for when it's used as an anesthetic and one for when it's used as an antidepressant. So I feel it makes more sense to explain the anesthetic one first, because it's an NMDA receptor antagonist, and the NMDA receptor is part of the glutamate neurotransmitter system, which is the main excitatory signaling pathway in the brain. By blocking NMDA receptors, ketamine disrupts normal communication between neurons. This results in dampening of excessive excitatory activity, which contributes to an anesthetic and dissociative properties. So then when it is used as an antidepressant, while ketamine inhibits NMDA activity, it increases overall glutamate release. This stimulates AMPA receptors, another type of glutamate receptors, which enhances synaptic plasticity and neural connectivity. These mechanisms are believed to underlie ketamine's rapid antidepressant effects, making it unique among treatments for depression. So yeah, it kind of just has two. And here's a chart that I found from Psychedelic Review that I felt was really good at explaining the mechanism of action. And then for the routes of administration, it can be administered in many ways. The main ones are IV, which is frequently used in clinical settings for anesthesia and depression treatment. It allows for rapid onset of effects. Intramuscular, this has both medical and recreational purposes. IM administration provides a quicker onset than oral administration and is often used in emergency situations as well. And then for oral, ketamine can be taken orally. However, it's not very good because its bioavailability is low because it has to pass through our mouth first to be metabolized. And it can also be inhaled, which is essentially just recreational users. They commonly snort ketamine. And then, yeah, this method is also rapid, but it also carries significant risk of misuse and dependency. Yeah, for the effects, ketamine's effects are based on the route administration and dosage and each individual, but here's a comprehensive list. For behavioral, ketamine induces sensory detachment, often described as an out-of-body experience, or the K-hole at higher doses. Motor coordination is impaired, making it unsafe to perform tasks requiring precision. Physiological, ketamine can increase heart rate and blood pressure, induce analgesia, and relax muscles at higher dosages. It's also associated with bladder toxicity and urinary tract symptoms with long-term misuse. And psychological, users may experience hallucinations, feelings of euphoria, and detachment from reality. For cognitive, ketamine use can impair memory, concentration, and executive function temporarily, but long-term use or abuse may lead to lasting cognitive deficits, mainly just like memory loss. And it also has therapeutic effects. Ketamine has shown a rapid reduction of depressive symptoms, even in individuals with treatment-resistant depression. It has also been explored for treating PTSD and chronic pain. And then, yeah, I thought this chart was also good at showing the different effects of ketamine. So, like, it can be good in just small doses, but when you use extreme use, you get the bad things. And then, yeah, just here's an expansion on how it works more with the antidepressant portion. I explained this a little bit in the mechanisms of action, but one of the most groundbreaking discoveries about ketamine is its rapid antidepressant effects. Traditional antidepressants, such as SSRIs, often take weeks to months to have noticeable effects, while ketamine has been shown to alleviate symptoms of depression within hours, even in individuals who have not responded to other treatments. So that is why like ketamine treatment facilities have been popping up. It's kind of seen as like the cure for depression. And then yeah, it just does this by releasing glutamate activating AMPA receptors, which promote synaptic plasticity, specifically in the frontal lobe, which is responsible for mood regulation and decision making. And here are the uses and the news about ketamine. Yeah, as mentioned, as therapeutic breakthroughs, ketamine has gained approval for treating treatment-resistant depression and acute suicidal ideation. Esketamine, that is like esketamine, is the name, like the brand name that is used, and it's marketed by Spravato. It is now widely used as, or available as a nasal spray, and then this is mainly used in more like outpatient scenarios. And yeah, there's recreational use and concerns. Ketamine is a popular recreational drug due to its hallucinogenic effects. However, misuse can lead to dependency, physical harm, and psychological issues. And authorities have raised its concerns about its availability on the black market and the need for public education about its risk. Research on PTSD and anxiety. Recent studies have explored ketamine's potential in treating PTSD and anxiety disorders. Preliminary findings suggest that ketamine can rapidly reduce symptoms and improve quality of life, prompting more clinical trials in these areas. And they also kind of mentioned that other hallucinogenic drugs are also being used, like psilocybin, which is found in like magic mushrooms, and also LSD. And then for veterinary medicine, yeah, ketamine is a staple in veterinary medicine as an anesthetic for animals, from small pets to large livestock. Its dual role in human and animal medicine highlights its versatility. And then, yeah, here are my references. Thank you.